Here we are. I'm excited at what we're going to learn tonight. So give me a minute so I can get everything. There we go. Good evening, everyone, and welcome again to Medical Mondays with Dr. O. I am Toyin Okpesome. I'm a family practitioner in Maryland and always excited to be here Monday evenings to come learn as well as impart. We have a very, very important subject today. Every subject is important. I don't know why I said that because everything we discuss is important. Tonight, though, is about lifestyle changes. And we have one of our sisters, Dr. Anthea Esege Nwandu, who is a board certified physician in internal medicine and lifestyle medicine with more than 30 years of experience caring for medically complex patients and teaching the next generation of doctors. Also, teaching healthcare providers. She currently serves as an attending physician in the Hospital Medicine Division at the Veterans Affairs Maryland Healthcare System in Baltimore, and she's also an adjunct clinical assistant professor at the University of Maryland School of Medicine. She holds a Master of Public Health degree from the Johns Hopkins Bloomberg School of Public Health and has extensive experience in global health, particularly with PEPFAR funded programs supporting HIV care in Nigeria, other African countries, and also in the US. Dr. Nwandu is passionate about the power of lifestyle medicine, which uses evidence-based lifestyle changes, nutrition, physical activity, restorative sleep, stress management, social connection, and avoidance of risky substances to prevent, treat, and even reverse chronic diseases.
Sleep in your book.
Outside of medicine, she loves traveling, dancing, reading, exploring new cultures, and cherishing time with her husband, 5 children, 2 grandchildren, family, and friends. Resilience, the love of God, fierce devotion to family and friends, and an unwavering commitment to excellence and integrity defines her both personally and professionally, and I can attest to it. So, without much ado, I'm going to yield the floor to our amazing sister physician, Dr. Anthea Nwandu. The floor is yours, sis. Kindly unmute.
Can you hear me now?
Yes, now we can hear you.
All right. All right. Good evening, everyone. And thank you so much, Dr. Opesami, for your kind introduction. Today, I'm going to be talking about the 6 pillars of lifestyle medicine, simple habits, and big impacts.
You're not showing, you're not showing in camera. We can see you on
You
camera.
can't see me on camera?
No.
But my video is on.
Really?
I thought you could see me.
No.
I don't know what else to do. It says
no,
my video is on and my audio is on, so I don't know what else to do.
quiet. When it gets to Q&A, we'll figure it out again.
Okay, but can you see my slides?
Yes, we can see.
Okay, perfect. Okay, great. So, good evening once again. So when Toyin, I'm gonna call her, permit me to call her Toyin, that's my sister. When Toyin asked me to share on Medical Mondays, I said to her, what is my target audience? Am I talking to physicians, healthcare providers, or lay people? And she said it's a mixed audience. So before I proceed, forgive me if there's anything that's too technical or too simple. I'm hoping that at the end of this talk, somebody will learn something. So as a medical educator, all my life, I always start off my talks with a learning objective so that you have kind of a framework for what we're going to talk about. And so the learning objectives for this talk are as follows. I'm going to define lifestyle medicine at some point. I'd like you all to recognize the magnitude of the US as well as the global healthcare system crisis concerning chronic diseases. I'm going to describe the 6 pillars of lifestyle medicine, discuss the importance of lifestyle medicine, review evidence and current guidelines for lifestyle medicine evidence-based practices, and hopefully at the end of this talk, everybody will be able to identify at least 3 practical strategies you can apply either in your life or your patients' lives to optimize health and well-being. So I'm going to, if I had a live audience, I would ask these questions and ask for answers. So, and I don't have an interactive screen, so I will just go ahead and ask the questions and see if you can think about the answers as we go along. So which of the following best describes the primary goal?
Answers can be put in the chat box.
They can? Okay,
Yes.
Can you monitor the chat for me then?
I will do that, yes.
Okay. Which of the following best describes the primary goal of lifestyle medicine? A, to replace all medications with diet alone. B, to identify and address root causes of chronic diseases through evidence-based lifestyle interventions. C, provide alternative medicine therapies without scientific basis or focus only on weight loss programs. So A, B, C, or D. The next question is, which condition has not shown strong evidence for improvement or reversal with lifestyle medicine interventions? Type 2 diabetes, cardiovascular disease, appendicitis, or cognitive decline, also known as dementia? Perfect. Excellent. According to the CDC, approximately what percentage of chronic disease risk is attributable to lifestyle and environmental factors? 10%, 25%, 60%, or 90%? I think throwing out an answer by voice is a good idea. Any guesses?
Yes. I think it was...
Pardon?
60.
60, okay. It's actually 90%. Significant percentage of chronic disease risk is attributable to lifestyle factors. Which pillar is not one of the 6 core pillars of lifestyle medicine? Whole food, plant predominant eating patterns, routine medical imaging, regular physical activity, positive social connections. Dr. Torian also actually mentioned that during her introduction. So I guess everybody knows the answer to that. It's routine medical imaging. Social isolation and loneliness carry health risks comparable to smoking 15 cigarettes a day. True or false?
True.
True. Number 1 cause of morbidity and mortality worldwide is a poor dietary pattern. True or false?
True.
True.
Excellent. Excellent. So like I said, I have some data slides to share just to show that what we're saying is not made up. So this is a huge survey done on hundreds and hundreds of countries around the world that looks at the number one, the top reasons for or causes for global burden of disease in general, total wise. In addition, this reflects data for cardiovascular diseases, respiratory diseases, cancers, COVID-19, and so on. And you can see that cardiovascular disease by far outweighs them all. This is from data published in 2024. Similar data exists for the US and other developed or first world countries. The latest data from those surveys demonstrates that dietary risks are the leading contributor to age-standardized cardiovascular disease, disability-adjusted lives. In other words, dietary risks are the number 1 cause. Poor dietary patterns are the number 1 cause of the global disease burden of cardiovascular disease. Think about that for a second. High systolic blood pressure accounted for the largest contribution to these DALYs, and global deaths due to cardiovascular disease increased from 12.4 million to 19.8 million and continues to trend upwards. The contributions from preventable, metabolic, environmental, and behavioral risks continue to escalate. And like I said, the data for the US is exactly the same. Dietary risk remains the leading cause of death and disability. And this is not made up. This is based on solid scientific data. So in the US, we're facing a chronic disease epidemic. And what are chronic diseases? Chronic diseases include all those diseases that you know about, or you've heard about, or you have patients or family members suffering with that are lifestyle related. What are the leading causes of death and disability in America? Heart disease, in other words, strokes and heart attacks, cancer, one of the most scariest words, cancer, all kinds of cancer, chronic lung disease, strokes, Alzheimer's, dementia, type 2 diabetes, and chronic kidney disease. And unfortunately, these diseases are the leading drivers of the nation's multi-trillion-dollar budget costs. As you walk around the streets in the US, and I can extrapolate this to the UK and other developed countries, not so sure for the West, the third world countries, but I would guess that it's probably similar. A lot of people are walking around with at least one chronic disease. Even more are walking around with maybe 2 chronic diseases. A third of the US population is obese, or third or more. 37 million people in the US are diagnosed with type 2 diabetes. A significant number of deaths are attributed to heart disease and strokes, and cancer is on the rise in the older population and in the younger population. So we're dealing with a chronic disease epidemic. And as like I said, 90%, above 80% of the nation's multi-trillion-dollar budget is spent on chronic physical and mental health conditions. So this is an unsustainable economy. The US also has the highest rates of avoidable deaths of any OECD country. OECD countries are those that have a very high income countries. The US, unfortunately, in spite of its wealth, has one of the poorest health indicators amongst the OECD countries. And so data published by the Mayo Clinic researchers demonstrated from the NHANES study. I'm sure the physicians in the group must have heard about the NHANES study. It's a very, very large prospective study. And they looked at over almost 5,000 adults and found that less than 3% actually fit the picture or the criteria for living a healthy lifestyle. And how did they define a healthy lifestyle? Healthy lifestyle was defined by people, you, me, others who live in the US, who engage in moderate intensity exercise for at least 150 minutes a week, a diet score in the top 40% of the healthy eating index, a body fat percentage under 20% or 30% for men, and those who do not smoke. I, for one, do not meet this criteria. I don't know about you, but many of us are not living what is defined as a healthy lifestyle. Causes of chronic diseases. What are the things that drive these chronic diseases we've just mentioned? Unhealthy lifestyle behaviors, including a poor dietary pattern, including smoking, an alcohol use disorder, physical inactivity, also known as living a sedentary lifestyle, excessive alcohol use, and tobacco use and street drugs, and poor social connections, also known as loneliness. These are the factors that are driving the chronic disease burden. And as you can see, these diseases are all lifestyle related. So just a little bit of pathophysiology for the physicians and medical people in the group. Chronic inflammation is across your lifespan, across a patient's lifespan, is the root cause of most chronic diseases. It's also been described as the silent fire. And what are the things that trigger these silent fires? Is your diet, could be your genes, sometimes it's your environment, it's exposure to risky substances, what happened to my slides? Oops. Are my slides still there?
Yes, they are.
Just lost my slides. Oh my Lord.
The slide is there. Chronic inflammation in the etiology of chronic disease across the lifespan.
Okay, there it is. All right, yeah. Okay, so the chronic inflammation, like I said, is the etiology of chronic diseases across a patient's lifespan. So the factors that affect us in our older age are also affecting us in our younger age. And it's been studied, and it's shown that this inflammatory process over time is what triggers most of these chronic diseases. What triggers this chronic inflammation are things in our diet, as we've said, our environment, exposure to risky substances, loneliness, and stress. Okay. Now my slides are not moving. Are they moving?
Um,
Oh my Lord.
you
Okay,
just completed this one.
yeah, just 1 minute.
Information in the etiology of chronic diseases across the lifespan.
Is it moving now?
Yes, it is.
Okay, there we go. All right. So, and what, like I said, chronic inflammation, the silent fire, there's so many results from this chronic inflammation. There's so many factors that lead to this chronic inflammation that are being studied over time. They start not as adults, but sometimes in childhood. And that is why in lifestyle medicine, the focus is on the entire lifespan. It's results of chronic inflammation include, like we've talked about, chronic lung disease, Alzheimer's, dementia, high blood pressure, obesity, type 2 diabetes, and so on. And so it's been studied by multiple researchers that what these factors do lead to alterations in our microbiome, in our gut microbiome, also lead to epigenetic changes, and also lead at the cellular level to damage to our mitochondria, the powerhouse of our cells. And this has been proven by multiple researchers, several evidence-based data, that interventions with lifestyle factors can alter these pathophysiology, can reverse or halt inflammation and lead to prevention or remission of some of these lifestyle-related diseases. Dementia, we all know about the global burden of dementia. We all know about cancers. It's been estimated that up to 40% of cancers can be attributed to modifiable risk factors, including our diet, alcohol exposure, physical inactivity. And so the World Cancer Research Fund estimates that approximately 1 in 3 cancers in high-income countries can be prevented by healthier diets, healthier weights, and regular physical activity. Physical inactivity is a recognized risk factor for different forms of cancer, particularly colon, breast, and endometrial. And alarmingly now, it's predicted that early onset cancer, so cancer in people less than 50 years old, is on the rise. So we all know, I mean, those of us who are providers, who are physicians, who are, in the healthcare providing business, we all know that clinical guidelines, professional guidelines, all recommend lifestyle changes. This is not made up. It's reinforced by leading national and international organizations. And so a few examples. The American College of Cardiology on primary prevention, the first 2 boxes is lifestyle modification. Management of hypertension, the Joint Commission on Management of Hypertension. The first box there is lifestyle advice or lifestyle counseling or lifestyle modification of lifestyle-related factors before medications. Same thing, the latest JNC committee guidelines for hypertension all recommend and emphasize lifestyle changes, smoking cessation, controlling your diabetes, your diet, and your physical activity. Same thing for diabetes. The American Association of Clinical Endocrinologists all recommend strict adherence to lifestyle modification to help improve blood sugar control. Same thing here. American Diabetes Association, recommendations for diabetes prevention, diabetes care, prevention of delay and of diabetes and associated comorbidities. Same thing here. So management of obesity, management of overweight, the first thing that's emphasized throughout the management of patients being managed for obesity or overweight is your lifestyle, your diet, your physical activity, sleep management, stress, and so on. Cancer prevention, the same thing. Lifestyle modification, healthier weight, being physically active, limit your diet, stress management, cancer prevention, as well as even cancer treatment. Same thing with dementia. Guidelines for managing dementia emphasize lifestyle modification. And now there's also studies out to show that if you intervene early in early cognitive decline, you can actually prevent progression to Alzheimer's. And this slide demonstrates a real-world impact of reversal of diabetes in action. The former, I don't know if it's former president, let me not misspeak, but Mayor Eric Adams, very well known in the media, was diagnosed with type 2 diabetes. And he decided that his prescription would not be medication, but his diet. And so he went on a strict plant-based diet, physical activity, stress management, sleep hygiene, and his A1C was reduced from 9% to 6% in the course of 6 months without medications. This demonstrates the potential for disease remission through intensive lifestyle interventions. There are many, many other examples, anecdotal as well as studied, of the impact of intensive lifestyle modifications on reversing and managing diabetes. Again, this is dementia. So there are randomized controlled studies that demonstrate the effects of intensive lifestyle changes on the progression of mild cognitive impairment or early dementia. It is important to emphasize that this study the studies were done on mild or early dementia, which is the time we need to intervene with comprehensive lifestyle changes. Once Alzheimer's is full-blown, unfortunately, it's currently irreversible. This is just a case study of a patient, someone I know, who had his aortic valve replaced. That is a picture of the aortic valve, totally stenosed and calcified with plaque. 90% of attributable cardiovascular risk is modifiable through lifestyle changes. This is a personal experience. This patient was discharged from the hospital after this intervention with no recommendations for his diet, no recommendations for exercise, no recommendations for his lifestyle. And so I just wanted to throw that out there as an example of how we are lacking in our health education and practice. So what is lifestyle medicine? Lifestyle medicine is a medical specialty that uses therapeutic, must emphasize the word therapeutic, lifestyle interventions as a primary modality to treat chronic lifestyle-related diseases, including cardiovascular disease, type 2 diabetes, obesity, and other lifestyle-related diseases. Lifestyle medicine clinicians are trained to apply these interventions in a prescriptive manner to treat, and when used intensively, often sometimes to reverse such conditions. And so those 6 pillars of lifestyle medicine you can imagine them as 6 interconnected pieces of a puzzle. And that puzzle is a patient's life, whole health. They include a whole food, plant predominant eating pattern. There's no prescription for a type of food or a food. It is an eating pattern. Regular physical activity, restorative sleep, stress management, avoidance of risky substances, and positive social connections. Lifestyle medicine interventions are based on strong evidence and research. They have demonstrated to be highly effective, have better health outcomes, and lower costs. They address the root causes of disease, and critical to lifestyle medicine practice is that it's a team-based care model with your patient as an active partner. And so we all know that there are other types of medicine. We're all trained in allopathic medicine, conventional medicine, where we're trained to focus on symptoms and signs, make a diagnosis, prescribe drugs, procedures, and so on. And the patient just basically does what you tell them to do. The doctor knows it all, right? Preventive medicine focuses on early detection, screening, environmental safety, and public health. Functional medicine, there's sometimes a blur between all these different types of medicine. But functional medicine focuses on novel diagnostic blood tests, nutraceuticals, and supplements. Integrative medicine blends complementary and conventional approaches. Lifestyle medicine requires a paradigm shift by us as providers, as well as the patients. And it focuses on the root causes of chronic disease, using a lifestyle-first approach for treatment and remission of disease. The patient takes on the role of the co-pilot of their care, and they are empowered and proactive to achieve their health goals. I must emphasize that lifestyle medicine is not against the use of conventional medicine or drugs or medications, but focuses on lifestyle first. So the 6 pillars, like I said, are all interconnected. They are the 6 of them: nutrition, physical activity, restorative sleep, stress management, social connection, and avoidance of risky substances. And these 6 pillars are interconnected, and they work together to optimize a patient or our health and well-being. I think I've talked about that. So why now, right? A global health survey, why lifestyle medicine? A global health survey report demonstrated that lifestyle medicine actually focuses on the conditions that consume 80% of healthcare visits, hospitalizations, and costs. So these 8 risky behaviors you see on this slide drive so many chronic conditions that are consuming 90% or even more of the nation's annual healthcare budget. So that's where lifestyle medicine focuses and comes in. I've talked about that already. So let's talk a little bit about nutrition. So there's extensive scientific evidence to support the lifestyle medicine recommendation for a whole food, predominantly plant-based diet as an important strategy in preventing chronic diseases, treating chronic diseases, and in intensive doses, even reversing chronic diseases. Notice I use the word dose. So these pillars are prescribed in doses that sometimes are required to be intensive, just like we have intensive medication therapy, intensive care units. Same way there's lifestyle medicine interventions that are actually intensive. And so those kind of diets are nutrient dense, rich in fiber and antioxidants, with a variety of minimally processed vegetables, fruits, whole grains, legumes, nuts, and seeds. And so it really goes back to the foundation of medicine, where Hippocrates, the founder of medicine, said, let food be thy medicine. So food can be medicine or it can be poison. And our diet is a super powerful medicine. A health promoting dietary pattern supports our immune system, our gut health, brain health, and like I've said, can prevent or reverse chronic diseases. But unfortunately, the fact and the truth is that over the last several decades, we have our grocery stores, our homes are being invaded by what we call ultra-processed foods and added sugar. And so what are ultra-processed foods? Ultra-processed foods are foods that have been demonstrated to have gone through multiple steps rather of processes, from being minimally processed to ultra-processed. These foods are designed to be hyper-palatable. They have a very long shelf life, and they're full of additives that have changed the natural state of that food. So many studies have demonstrated, published in JAMA and other databases, that ultra-processed foods are driving the cardiovascular disease, the chronic disease burden globally. And so those foods are what we're focusing on in our diet to try and minimize. Yeah, let me move to this one. Right? Yeah, so there we go. So this is an example of an ultra-processed food. You have an apple that is fresh, whole, and not modified. When it's processed into applesauce, it's modified, processed further into cereal, like that they call Apple Jacks. By the time foods are ultra-processed, they lose their nutrient value. They become nutrient poor and calorie dense. So like we said, facts about food. Unhealthy dietary patterns are the leading cause of all-cause mortality and morbidity, okay? Unhealthy dietary patterns are costing taxpayers millions, billions every year. Great adherence to various healthy eating patterns has been consistently associated with the lower risk of total as well as cause-specific mortality. And if you think about the COVID pandemic and you look at the data, deaths attributable to poor diet are actually 4 times what was attributed to the COVID pandemic. So it's really a serious problem. So in the US, studies have shown that the majority of our diet comes from processed foods. That's a no-brainer. The standard American diet, unfortunately, is leading to standard American diets that are leading to standard American deaths. 63% of America's calories come from refined and ultra-processed foods. Very small amounts of our calories are coming from plant-based foods. And there's multiple databases, randomized controlled trials published that demonstrate that cardiovascular disease can be reversed. Adherence to the Mediterranean diet lowers the risk of dementia. The DASH diet, a dietary approach to stop hypertension, a very powerful diet, has been demonstrated to reduce systolic blood pressures by up to 14 millimole mercury. And that is equivalent to what an antihypertensive drug can do. And like we said earlier, a significant percentage of cancers can be prevented by modifiable lifestyle-related factors. So this is just, I put this in here because I found it really interesting. Those of you who watch Netflix, there's a documentary there called You Are What You Eat. And I find that title to be so true. You literally are what you eat. This twin experiment was conducted by Dr. Richard Gardner, was the documentary is free to view on Netflix and was shared at the most recent Lifestyle Medicine Conference, where they randomized sets of identical twins, and that using identical twins eliminated the risk of the influence or the confounding effects of genetics. So they looked at identical twins, randomized them to an omnivorous diet, so an animal-based diet, to a vegan diet, and they were followed over 8 weeks. I'm not going to go into details of the study, but the outcomes at 8 weeks demonstrated a significant drop in LDL in the vegan twin. Markers of cardiovascular inflammation, commonly known as TMAO, was decreased in the vegan twin. They looked at stool that showed that the gut microbiome was more diverse in the vegan twin. And they even looked at genetics, and the epigenome demonstrated that there was actually decreased biological age of the vegan twin. So it was a short study. It was the study size was not very large, but however, it was randomized. It was a scientific study, and it demonstrated that you can actually change your biology in a short period of time just by changing your diet. So what do our clinical guidelines recommend for our diets? Again, ACL, the American College of Lifestyle Medicine, did a systematic meta-epi study of all the guidelines from multiple professional guidelines, and they all demonstrate or recommend the same thing. Overall dietary pattern, top encouraged foods, whole food, plant predominance, vegetables, fruits, nuts, and seeds. Avoid, minimize, discouraged fatty meats, refined grains, processed meats, and red meats. And this is the ACLM dietary spectrum. And this is a position statement by the American College of Lifestyle Medicine that looks at our standard American diet and the spectrum all the way to an ideal diet. It's important to note that every patient is different, everybody is different, everybody has different comorbidities, different medical conditions, and so it's not a one-size-fits-all. And we do recognize that it's not easy to radically change your diet, but so you have to engage in a lot of counseling, a lot of coaching, a lot of setting of goals, dietary goals, to try and move yourself towards the healthier diet. So it's a spectrum. There's no one size fits all. Everybody is different. Everybody has different diseases. And so we do recognize that. But the ideal diet is a whole food, plant-based dietary pattern. The next pillar is physical activity. Regular and consistent physical activity combats the negative effects of a sedentary lifestyle. And the sedentary lifestyle has been demonstrated to be associated with many, many, many chronic diseases, including cancer, diabetes, obesity, dementia, depression, and so on. And it's been estimated that 1.8 billion adults worldwide are physically inactive. So what is exercise? Exercise is medicine. What are the health benefits of exercise? It's been demonstrated in studies that dementia risk is decreased by 30%, risk of all-cause mortality is reduced by 30%, cardiovascular disease is reduced by 35%, type 2 diabetes by 40%, and so on. The health benefits are endless. And so the American College of Sports Medicine is actually pushing this agenda to call exercise medicine, as well as assessment of exercise to be included in our vital signs assessment. And so the lifestyle medicine, we actually have a prescription where we prescribe exercise, and it's called the FIT. FIT means frequency of what should be the frequency of your exercise, how intense should your exercise be, how long should you exercise for, and what type of exercise. And that is a tool that is used to assess and prescribe your exercise dose. These are the guidelines published by the American College of the Physical Activity Guidelines for Americans. And it's recommended based on studies that demonstrate or to improve your health and to get health benefits. You should be exercising at least 150 minutes a week. And that exercise should be moderate intensity. In addition, you need to also engage in muscle strengthening activity to build your muscles at least 2 days a week. Now, this is the recommended guideline. Not everybody's at this stage, but this is what is recommended that you work towards. Restorative sleep is another pillar of lifestyle medicine. Inadequate sleep causes all kinds of disease. When we sleep, we're not resting, our body is actually working hard. It's recommended that we sleep at least 7 to 9 hours nightly to optimize our health. Restorative sleep is critical to good health. When we're sleeping, our body is restoring, our body is resetting, is repairing. The brain is engaging in anti-inflammatory processes. our mood is improved, our heart health is improved, our memory improves, our brain health improves, and you're just re-energized. So a quick way to know if you're sleeping well at night, sleeping enough at night, is when you wake up in the morning, how do you feel? Do you feel restored? Do you feel tired? Do you feel groggy? You may need to have your quality of sleep assessed. Next pillar of lifestyle medicine is stress management. Stress can be good, stress can be bad. Stress that is bad, that is chronic, over time, elevates our levels of cortisol and leads to chronic diseases, including anxiety, depression, obesity, even immune dysfunction. So helping patients to recognize negative stress responses, identifying coping mechanisms, and stress reduction techniques help to improve health. And some of those techniques include mindfulness, showing gratitude, yoga, Tai Chi, music therapy, and so on. Avoiding risky substances. Many of us are dealing with addictions. Many of us are managing patients with addictions. Tobacco and excessive alcohol consumption increases the risk of chronic diseases and has a similar impact from opioids and recreational drug use. We all know that addiction medicine is a whole different field, but it is important to recognize this problem and refer to the appropriate provider. The final lifestyle medicine pillar is positive social connections. Your positive social connections, your relationships affect your physical, mental, and emotional health. And leveraging the power of relationships and social networks can actually help to reinforce healthy behaviors. The US Surgeon General published this from the CDC in the US, demonstrating that we actually have an epidemic of loneliness. 1 in 10 people have reported that they are lonely every day. 5 in 10 people report having 3 friends or close confidants or less. There's a huge epidemic of loneliness in the US, and loneliness has been associated with an increased risk of numerous adverse health outcomes, including heart disease, strokes, dementia, and suicide. And this epidemic of loneliness is not limited to the US, it's the general population, it's also very heavily amongst physicians and healthcare providers. Loneliness is associated with an increased risk of multiple physical illnesses. This was published by the US Surgeon General in 2023, with data demonstrating that chronic loneliness is associated with these chronic conditions. And like I said earlier, lacking social connections is as dangerous as smoking up to 15 cigarettes a day. It is dangerous. It is not good. It's a critical determinant of well-being, it's a stressor, and chronic stress leads to chronic inflammation. And this is kind of the pathophysiology behind why loneliness affects our health. The longest Harvard study on happiness, conducted over decades by researchers at Harvard, concluded that the people who are the happiest, who stayed the healthiest as they grew old, and who lived the longest were the people who had the warmest connections with people. It's just as simple as that. No medications, no drugs, just relationships. It's positive social connection. And the power of this was demonstrated in this Harvard study that was conducted over, I think, 3 decades. So is loneliness making us sick? Possibly. We are wired to be social. Our brains release specific neurochemicals that make us feel good. We get the same flood of positive emotions when we feel close or connected to someone or receive comfort or care from a person who loves us. So maintain your positive social connections. I encourage you all to really invest in your relationships and your connections. So lifestyle medicine practice is fundamentally a team-based approach. We use validated assessment tools to assess each of the pillars I've discussed. Critical to lifestyle medicine practice and to changing our behavior is, changing your lifestyle is behavioral changes. And we all know as providers that behavioral change is very difficult. We don't have the time, we don't have the expertise, we don't have the knowledge, some people don't, to actually engage in professional behavioral change counseling. It is not just sitting down in your office and saying, do this, do that. It's a lot more than that. And so lifestyle medicine requires a multidisciplinary approach to care. It's team-based, and those team members include physicians, nurse practitioners, physician assistants, health and wellness coaches, dietary coaches, exercise therapists, positive psychology interventions, and addiction counseling. So it's a multidisciplinary approach, and team-based is critical. And as I mentioned earlier, the patient is not a recipient, the patient is actually a co-pilot in their care. There are novel methods and approaches to applying lifestyle medicine. Various models have been applied in practices, in person. Some include shared medical appointments. Some include culinary medicine programs. In this world of tech, there's digital health tools and new technology platforms that include remote patient monitoring, messaging platforms, and lifestyle medicine critically leverages the coaching, behavioral, and positive psychology world. So these are the tools that are used for integrating lifestyle medicine into practice, setting smart goals through coaches. I will skip this slide, and I just want to say that lifestyle medicine actually achieves the quintuple aim, which include enhancing patient experiences. It's focused on achieving health equity. It saves costs. Physicians are less burnt out, and patient clinical outcomes are improved. Lifestyle medicine leads to greater health benefits and re-envisions clinical outcomes. We have demonstrated improvements in chronic medical condition. In addition, we've also demonstrated reversal of coronary artery disease, remission of type 2 diabetes, and actually reduced risk of Alzheimer's dementia. So what is our call to action? Start small. None of this can be achieved overnight. Eating is a lifestyle. Lifestyle is medicine. But your lifestyle is literally over your lifestyle. It is a journey that you take one step at a time. Use evidence-based resources. This is for us, advocating for pre-service integration, because our medical education is actually lacking in nutrition science as well as lifestyle medicine science. And lead by example. Practice what you preach. Establish your why, establish your health goals. If you have a healthy patient, you have a healthy family, make every bite count towards improving your health. And together, once with this knowledge, we can transform our healthcare from being reactive to proactive. And I said in the beginning that hopefully we can all identify 1 or 2 or 3 simple steps that we can take today to improve our health and begin to restore our health. You can choose something in your diet. You can choose one item in your diet that is less health promoting. Identify a food that is more health promoting. You can start to exercise more regularly. You can start to take a walk. You can spend time with family and friends. You can be intentional about doing these things. You can learn to identify stressful situations and create boundaries. You can minimize your screen time from social media. You can also, if you're a smoker or you are suffering with addiction, you can seek help. If you're not able to do these things by yourself, please seek help. And so I also reflect on my practices often, and I realize that taking care of myself is not selfish. We must practice what we preach. I know that my health affects my patient's health and my family's health. And our no health behavior change starts without understanding why you need to change that behavior. It's never too late to start. Meet your patient where he is or where she is. Meet yourself where you are. Everyone's story is different. That's my whole health. Those are my kids, one of my grandkids. That's me trying to keep fit. I try to eat a healthy diet. I'm not always successful, but I try, fail, and I try again. And that's me. Keep moving. This is the Lifestyle Medicine Conference 2024. Keep moving means keep learning, keep exercising, keep trying, just keep it going. Don't stop. Once you stop, you're dead. So just please keep moving. We're all learning in this game. We're all learning. All of us are constantly learning and trying to improve our behaviors as well as our health. And so on that note, I just want to say thank you. I think I've been speaking for almost an hour now, and I'd love to entertain any questions, comments, concerns about the many, many things I've just said. A bit too much, I may add.
No, it wasn't too much. And
I think it was a bit too much.
So if you
Dr.
put this slide
Nwandu.
down, now put this slide down for me for a minute. Thank you so much. I know that
So
you were
I
driving
guess you
from
should
work.
end the show, yeah.
Yes, and sure. So you were driving from work, you rushed into this.
Yes.
Flight did not want to cooperate, but you gave us men.
Can you see me now?
Lifestyle change.
No, we can't see you.
Not yet.
Why can't you see me? I don't understand.
I have this speaker thing. It's a dark dot.
That's so
Wipe,
strange.
wipe,
Are you sure
wipe
you
the,
don't have like a
wipe the,
lid over your camera?
yes.
Sometimes like you can slide a lid where your camera,
Oh,
there you go.
yes.
I'm rushing to get back from work.
Yes.
I'm so sorry. Okay, hi everyone. You can see me now.
Yes, we can see you now. And you know what? Thank God we can see you because, I want to appreciate you that you rushed in from work. Nothing seemed to want to work. And I was begging you to please take 5 minutes,
You did.
but you won't listen. You're
But I
like,
have to
just get me
we
in,
have to
just get
respect
me in.
people's time.
I know, I understand, and we understand. We appreciate you. Oh my gosh. Thank you so much. That you gave us a lot, a mouthful in a short period of time.
Yes, a
But I
lot.
wanted people to see you, to know that you made a statement that, yes, you're not perfect. None of us is perfect. But you said you have not met the goals of that slide. And I want people to see how beautiful you are. That honestly, if they can see you and even see your tummy after 5 children, that is as flat as can be, and that you are living what you preach. It is very important.
Yes, and that is really my message, my take-home message, is that none of us are perfect. We all are trying to achieve that North Star of optimal health, and it's not easy. It's not easy. So you try, you don't succeed, you try again.
Yes.
I didn't speak much about setting goals, but that's part of motivational interviewing and coaching. Each of those pillars, you need assessment, you need to identify your goals and work with someone who can help you to be accountable to achieving those goals over time.
And I want to tell you already in the chat box, I say very educative. Thank you so much. And
Okay, I don't even see that.
clap. And yes, we can see your beautiful face. Thanks a lot for this heavy dose of education, Dr. Alu said. So, Madam VP, Madam CEO from California, kindly unmute, ma'am.
Okay.
You have your hand raised.
Okay.
Yes,
Yes.
welcome, ma'am.
Thank you, Dr. O. We did it again. Another fantastic speaker.
Yes.
So, lady, I want to thank you. I'm sorry I can't see your name because I'm driving as well.
Anthea,
Sorry, I'm sorry, it is my work laptop. My name is Anthea Nwandu. So it's
Anthea.
VHA Baltimore Wanda. It's my last name. It's a work laptop. That's why it has that there.
Anthea Nwandu. Okay.
Yes.
Nwandu, yes.
Dr.
Yes.
Nwandu,
Okay.
yes.
Sounds like she's from Abeokuta.
No, I'm actually
You have been adopted. Hey.
No. She's from Abeokuta. She's my sister. She won't argue that.
Thank you for a very pragmatic presentation, very loaded. And for the acknowledgement that, yeah, we're all work in progress, including you, because, it's really important to know that physicians are human as well. Because prescription is so easy. Prescription is easy, but taking the dose is much more difficult. But I want to crave your indulgence. I think you presented way too much. We need to break it down into 5-part series.
It's a lot.
Yes. We need a 5-part series.
Yeah, each pillar can actually be one talk.
Yes.
Okay. Yeah, but I'm interested in the lifestyle medicine. So if Dr. O would please schedule you that we can dedicate a session to that so that we can give a lot of pragmatic examples. And I know we've heard bits and pieces of all of this in different ways, but like you said, you keep learning, you keep doing, you keep learning. It's like a stairmaster. You keep learning, you keep growing, you keep adding, we're not going to, for those of us that have not done all of this in a long time, you're not going to suddenly be doing all of this now. So we need to keep doing, but everything you presented was so great. But I'm going to draw a light moment out of what you said, because you physician, you always say you are what you eat. So when you eat meat, that means you're a goat or something. When you eat fish, that means you're fish. No, I know what you guys are trying to say, but it's very funny to me. But we appreciate all the research, because you can see that in the data that you presented. But Dr. O, please, if we can kind of peel the onion when it comes to the the lifestyle medicine. Because, especially when it comes to reversal of certain things, that means that there's hope. There's hope for all of us in some areas. There's some things that we need to start doing now, but when there's possibility of a reversal, that's so motivational. It motivates people to want to do more. So I want to thank you again for giving us all of this great information. God bless you. Thanks, Dr.
Amen. Amen. Thank you so much, Ma. Thank you. So there's a lot in lifestyle medicine that we were not taught in medical school.
So much.
Unless somebody is a physician on this platform, they would not know that. So much. I learned through actually on Medical Mondays with Dr. O, when one of our lifestyle medicine doctors presented like 2.5 years ago, I think it was, or 3 years ago. I found out about TMAO, that is a killer, predictor of cardiovascular disease. We don't ever check that in allopathic medicine because we were not taught. So
it's a cardiac marker of inflammation.
yes. So what can one do to prevent that?
So, I mean, TMO is a marker of inflammation. In lifestyle medicine, it's not, you don't focus on one thing. You focus on so in your diet, the biggest source of TMO is your meat, red meat. It's red meat that triggers formation of TMO, and TMO leads to inflammation, cardiac and cardiovascular disease. So, it boils down to the same dietary recommendations, which is minimize red meats, processed meats like pepperoni, bacon, sausages. Those are the drivers of TMO in a nutshell.
Okay.
So you can see I think we have some cardiologists on the call.
Yes.
They strongly advise or recommend against red meats, processed meats, fatty meats.
Okay. Thank you so much for that. Also, you talked about obesity. Obesity is a big problem. It's now a disease entity in the US, period. During COVID, like you mentioned, there were certain things that when people have it as part of their issue before and they get COVID, their chances of dying was higher. Obesity was one of it. So I guess, I just want to challenge every one of us on the platform. If your body mass index, which is your height compared to your weight, if you don't know it, please ask your primary care doctor to help you know what it is, what yours is. If it's over 25, please work on your diet and exercise. Dr. Ezugu, kindly unmute.
Okay.
Thank you.
Sister Anthea, thank you so much.
Hey! How are you?
Great,
Good to see you. Good to see you.
I'm here. Thank you so much. That was a beautiful presentation, actually, and a lot of excellent information, and especially really telling people about lifestyle. There is nothing you can do about your health without lifestyle changes first. And if possible, even share this slide, so that people can really understand and revisit that at their own and use it to teach other people as well. And that's why in cardiology, no matter, even if you get heart transplantation, we want you to exercise. We want you to make changes. We want it, no matter what. Rehab is very important. We have to get that body moving. So really, I support everything you said here with keeping the body healthy. Thank you. That was excellent.
Thank you.
Sure.
Can I make a comment on the BMI, Dr. O?
Please.
So in medicine, we're constantly learning things, that science is constantly evolving, and obesity medicine is now more or less a subspecialty. So if you talk to anybody in obesity medicine, they don't use BMI anymore. What we follow, the trend is focusing on a healthy weight. And the reason is because the BMI doesn't distinguish between fat, muscle, bone. And so it's not an accurate, it helps to put people in buckets, like severely obese, moderately obese, overweight, and so on. But it doesn't help with management. So we encourage people to focus on a healthy weight or a healthier weight versus focusing on the BMI. Just a quick comment on that.
Thank you. Thank you
And
so
also,
much for
and
that.
also I mean, yeah, like you said, obesity is a disease, it's a chronic condition. And there's many factors that lead to obesity. Some are genetic, some are environmental, some are immune mediated, there's so many things that cause obesity. So it's not as simple as go on a diet or exercise. There's a lot more to it than that. So I want anybody who is battling with obesity not to feel bad about not being able to lose weight. I just encourage anyone who is battling with obesity to seek help. We now have obesity specialists who are able to manage, and there's lots of help available.
That is 100% true. That was why I said, go to your physician to talk about BMI, because that's where to start. It was why I said that, especially we Africans that are large boned. Unfortunately, you and I did not qualify. We don't qualify for that. I don't know where I got mine from too, that I'm not large boned. But Africans are normally large boned, and BMI does not, just support our build. Our God made us. Because, BMI did not account for that large bond. The people they used to come up with BMI are not people like us, but it's a good start. Go to your doctor.
Put you in your bucket.
That's what I was trying to push for. Thank you for that point. I have a question here for you in the chat box. T says, thank you so much for the presentation. Can you please talk a little bit about the possible reversal of Alzheimer's? Can you suggest the type of lifestyle change that can support the reversal of Alzheimer's at the early stages?
Good. That's an excellent question. So I want to be careful with terminology. Alzheimer's cannot be reversed. What the studies have shown so far, and that I shared this in one of my slides, a randomized clinical trial published by Dean Ornish and colleagues and researchers, and a few others actually, have demonstrated that if you're able to detect early cognitive impairment, early, so the key word is early. The studies were done on people with early cognitive impairment. They did demonstrate that there was delayed progression to full-blown Alzheimer's. I didn't say reversal, please. Once full-blown, and I've listened and spoken with many, many Alzheimer's specialists. Once Alzheimer's disease is full-blown, it's no longer reversible. All the medications that they're trying to bring out now are all managing symptoms. None so far have been demonstrated to reverse. So the key is, what is dementia? What is cognitive impairment? How do we pick it up early? What are the clues to a loved one that may have, memory loss, cognitive impairment? That is the key. The key is picking it up early, and then you intervene with lifestyle. What are those lifestyle interventions that have demonstrated to delay progression? One is the diet I talked about, a whole food, plant-based, predominantly plant-based diet, high fiber, avoiding or minimizing processed, ultra-processed foods. And unfortunately, ultra-processed foods are everywhere, in our hospitals, in our homes, in the grocery stores. The shelves are like minefields. They're full of these. So it takes a lot of intention. If you have a patient or a loved one who has early cognitive impairment, you probably would benefit tremendously from talking to a lifestyle medicine trained nutritionist to actually develop a diet that is appropriate. In addition, physical exercise, the recommended dose, not just taking a walk here and there, but the recommended dose, which is for health benefits, is, like I shared, 150 minutes of moderate intensity exercise a week. And you can break that down, 30 minutes a day of brisk walking, dancing, 1 hour a week, 3 times a week, however you want to break it down. But the important thing is it needs to be moderate intensity. And what do we mean by moderate intensity? That means exercise that you do where you can talk, but you cannot sing. So diet and physical exercise are critical lifestyle interventions to help delay progression of mild cognitive impairment. I will share the slides, the study is there, the recommendations are there, and that is why, and it's not easy. You can't just say, okay, go and eat this, go and eat that. You need to have a team that's helping you with that diet. There are also intensive lifestyle intervention programs out there that actually engage in people like this who want to delay onset of cognitive impairment, who want to reverse the diabetes. There are programs out there that people actually go to. I think I'll stop there. Does that answer your question?
Yes, thank you very much. Absolutely.
Okay.
Thank you. And T, please come next week because there's more on dementia
Okay,
that
good.
may be very helpful for, to answer that question even further. There are certain interventions that will be discussed next week. So another question, how do they determine what a healthy weight is per person?
So when we talk about healthy, being a state of health, it can be emotional health, it can be physical health. But physical health, we look at, in conventional medicine, we look at numbers. We look at blood pressure, we look at your cholesterol levels, we look at your hemoglobin A1C, we look at inflammatory markers. There are some people who are quote unquote overweight who have healthy parameters. Their parameters are all within normal limits. And so for people like that, you want to help them stay within those parameters. I can't really say what is a healthy weight. It's all has to be individualized for your particular situation. My weight may be healthy for me, but it may not be healthy for somebody else. So that is something you want to discuss with your doctor. There's no number, there's no magic number that says this is a healthy weight. It has to be looked at in the right context. Does that answer your question?
Yeah, I believe so. Irene, does that answer your question?
Yeah, it's like saying what is a healthy, what is the ideal. Yeah, you have to individualize it. You can't really say this is the ideal weight for a person.
So I believe that's the answer. I mean, that's where we are now in medicine. Even when we were using the BMI, like alluded to, she says, thank you. Yeah, it answers it. We use it with wisdom.
Yeah.
Because when we see Africans, large boned, we don't go by what we have in the books. It takes experience to be able to do that. So again, it is individualized.
Yeah.
Like Anthea just said. And there are many still more appreciations in the chat box. Reading, very apt. Thank you very much. Congratulations on a well-presented and informative session. Thank you for such great presentation. And this is my auntie. Auntie Fumi says, thanks a lot for the presentation. Heard and learned a lot too. Glad we all keep trying to reach our goals. She says, I need your help, but we'll reach out to you through Dr. O. Thanks again.
Okay, that works.
So excellent work.
That
with
works.
Great content. Well done.
That works.
Thank you for the presentation. I'm really educated, taking away that phrase, if you fail, keep trying. And yes, thank you for all of us. I take that one away too. Big thanks, great job, and blessings to all. None of us has fully arrived. Life is truly a work in progress, but the ultimate goal is to reach the perfect destination we all desire. Yes, thank you. So, question. And I'm going to round up the questions in a few because guess what? This amazing woman here, you won't believe what she still has to do tonight. It's incredible. So, so I'm going to just ask a couple of more questions.
Okay, sure.
We're gonna let you roll.
Mm-hmm.
Oh, I just saw a question on cancer. Where is it?
I think I saw it too. What is a good diet
what
for
is
cancer?
a good diet? Yeah.
Okay, so perfect. So again, one of my slides shows what the World Cancer Research Fund, and other cancer professional organizations recommend. They all recommend the same pattern. It is not one particular food. It is a whole food, plant predominant based diet. And we get, I think some other speakers said that we can spend a whole hour talking about what the dietary recommendation should be. The long and short of it is, let me give an example. I had a family member who was undergoing chemotherapy for cancer in Nigeria. And he told me that he was told by his oncologists not to eat fruits and vegetables. And there's nothing I could do to change his mind because his oncologist told him that. We as providers, it is our responsibility, our duty to educate people, not just patients, but providers as well, that you cannot go wrong with eating foods that are rich in antioxidants and fiber and plant-based protein. Cancer cells thrive on sugar. Cancer cells thrive on excessive sugar. So what are the foods that we eat that are full of sugar? I don't have to tell you. What are the foods that are low in processed sugars? I don't have to tell you. There's so many. You just Google them. There's so many of them. What diet is inflammatory? What diet is anti-inflammatory? It is not one particular food. It's a pattern. We recommend eat a rainbow of colors, a rainbow of fruits, a rainbow of vegetables. Eat whole food legumes, whole grains, legumes, beans, lentils, things like that. Plant-based predominant. We don't say don't eat meat at all, but we do know studies have shown that red meat, processed meat, does not do you any good and may even be harmful. So some foods are health promoting and some foods are actually health damaging. So for cancer patients, you want to focus on foods that are anti-inflammatory, that are foods that are antioxidants, foods that are not processed, and foods that do not have a lot of excessive additional sugar, because cancer cells thrive on sugar.
Thank you so much. The plant-based diet. When Dr. Sandu, lifestyle medicine trained physician, talked to us and gave us 3 months free. She gave 10 participants on Medical Mondays. She gave free 3 months weekly
dietary plan.
Yes, not plan, actually, all lifestyle she discussed with us and insisted I should participate. It was total plant-based. That was what I got out of it. No fish, no lamb, no meat, no chicken, none of those. And then the healthy plants, she taught us how to make sweets or whatever from, what's this fruit that,
Dates. To sweeten.
Yes, sweetener from dates that you cook, you taught us the process and all of that. I started shedding weight that I didn't need to shed.
So that means it's not right for you. Remember, it has to be personalized.
It wasn't. That's my point. It had to be personalized. And she told me to start eating beans, to start adding weight. I still have not gotten that weight back till now. This was like 1.5 years ago.
I think it's also important to remember that whatever pattern, whatever diet, whatever food we're eating, it should be something that we enjoy. Food is meant to be enjoyed, you're not meant to be suffering while you're eating. And it should be a pattern that you can sustain over time. So you start changing your pattern, your eating habits today, tomorrow you revert. It's better and easier and more sustainable to make small changes and then sustain them over time, rather than having drastic changes. That's just,
But in the case of cancer, especially when somebody already has cancer, they can change to life.
Yeah, you can do intensive lifestyle changes. Yeah,
that's important. So another question: can you relate the role of herbal medicine in the equation? That's Dr. Damien from he tuned in from the Caribbean.
Oh wow!
Yeah.
Hi. So I can't claim to be an expert in herbal medicine. I can't. So I can't really speak to herbal medicine, but I do know that there are a lot of medicinal benefits of herbs and spices that sorry?
No, Somebody wants to.
Okay. So I do know that there are a lot of medicinal benefits of herbs and spices, especially like, the Ayurvedic medicine, they rely a lot on herbs and spices. The Mediterranean blue zones, they use a lot of herbs and spices. So they are beneficial. It is recommended to use, there are some spices like cumin that are anti-inflammatory. So there's no real harm in playing around with herbs and spices. It's just that they're not
researched.
They're not regulated like drugs,
And
basically.
they're not researched.
Yeah, but they do have medicinal properties.
So some people go for surgery to remove body fat. How safe is that procedure? And what would be your advice about it?
That's not a straightforward question. So people who go for liposuction, that's what you're talking about?
Yeah, maybe, yeah, body fat. Yeah, that would be, especially
liposuction.
Liposuction, yeah.
Yeah, that's liposuction. I mean, that is, most times liposuction is done for aesthetics. It's not done for health. It's not done for health reasons. If you're doing it for health reasons, then it's, bariatric surgery and so on. But so liposuction is aesthetic medicine. Is it dangerous? I don't know. I don't do it, so I don't know. But I mean, any procedure can go wrong, right? It depends on who does it, where you do it. I know people who have done liposuction because their mental health was being affected by their body, and they just didn't like the way they looked, and they did liposuction and they felt a lot better emotionally. So if that's what that person needed to do to improve their mental health, the person did it. So it's not really something I can say is bad, is good. It's again, medicine has to be individualized in this day and age. We can't really, it's not black and white. There's lots of gray zones. So liposuction has its role, for those who do it, for whatever reason. I cannot sit here and say it's bad or it's good.
Well, I agree. However, even after liposuction, lifestyle changes is very important.
Absolutely.
Because if that lifestyle change does not occur, then the fat will grow all over.
That might come right back.
So,
but that is if the fat is related to their lifestyle. It may be something else. So
that's why, again, you're right. It has to be individualized. So can mothers' eating habits during pregnancy cause autism in children? Next week, we're going to talk about that. Also, please show up next week. Autism, dementia, and I think something else. Okay.
Diet plays a huge role in autism. Even what the mother eats during pregnancy can affect the baby unborn child. So yes, it does affect.
Galaxy 25 Ultra will love to know your name. Kindly unmute and ask your question. So,
hello, good evening.
Mr. Lawal, sir. Good evening, sir.
Sorry, I didn't know my Galaxy is not even my name.
Yes, sir.
Anyway, thank you for a very, very valuable presentation. I'm sorry, I hope you can hear me. I'm driving.
Yes, we can hear you.
My question is very simple. I hope it can help. You said a lot of things about how sugar is bad for you. And we had that before many times. And then they tell us to eat fruits and vegetables. So most of the vegetables are full of sugar. Sort of, how do we differentiate between good sugar and bad sugar in fruits?
Excellent question. So the sugar that you have in fruits and vegetables is natural sugar. It does not have the health damaging effects that processed sugar has. When I say sugar, I agree. We should actually distinguish what kind of sugar we're talking about. We're talking about processed sugar, sugars that all those fructose and high corn syrup, those kind of sugars. The sugars that you find in fruits are not detrimental, and they're very, very easily metabolized, and they do not cause health damage.
Okay, even in bananas.
Mm-hmm.
Okay, wonderful.
But then again, remember that all these recommendations are generalized. You have to individualize your recommendations based on the patient's comorbidities and situation. So there are some situations where you need to you have to modify your diet recommendation a little bit based on what's going on with the patient.
Okay, wonderful. Thank you very much.
But in general, fruit sugar is not dangerous.
Okay, good.
Thank you, sir.
Good to
So
know that.
taking one
That's
more question.
reassuring.
Sir?
That's very reassuring. Very reassuring.
Yes.
Good to know that. Yes.
Yes, sir. Thank you, sir. So Dr. Ajagbe says, one of the lifestyle changes to bring to the forefront is removing antibacterial mouthwash because there is evidence to indicate increase in blood pressure with antimicrobial mouthwash. That has been discussed on Medical Mondays in the past. Thank you for the comments, sir. So one more question. Do you have a nutritional coach that can be recommended?
Well, I work with the Veteran Affairs, and the Veteran Affairs, they do have nutritional coaches. I don't know, I don't have any private in this area. Unfortunately, I actually tried to Google that for my friends. I'm not aware of any so there are nutritional coaches and there are lifestyle medicine certified nutritional coaches who are trained along the principles of lifestyle medicine. So I'm sorry I don't have any, but I can inquire further. I can check in our database, but I don't know of any in this area that are actually trained in lifestyle medicine.
Thank
Sorry.
you. I'm going to look also.
Yes, I'll search. I'll
I'm
research.
going to look. I'll search. It's important. Somebody came to mind, but I have to be sure.
Within the college, the American College of Lifestyle Medicine that I belong to, there's a database, so I can search in there, by state for providers. The last time I checked, which was about a year ago, there was none in this area.
Thank you. So, because I would like you to go get ready for everything you're doing, but before you go, I want to share something. And then I would ask you to give us your parting words. Dr. Jagbe, kindly put the video on. This month, on the 20th of September, I was nominated, I think, by Dr. Aluya, and I'm being awarded an award that blew my mind. It's very humbling. I'm grateful. And I'm inviting everyone who can come to New York to come celebrate with us. So please.
Congratulations.
Thank you. So I wanted to share, the mayor you mentioned is actually one of the honorees.
Okay.
Will be there.
He's one of our poster children.
Yes, I was excited
Lifestyle medicine. Yes.
when I see him. I'm going to tell him, "Ooh, thank you."
Yeah.
For the lifestyle, for living that lifestyle to just help us that this works. We've seen reversal of disease entities with change in lifestyle. That is the truth. And for somebody his caliber, showing us that it works, is fantastic. Dr. Jackie, where are you, sir?
I'm here. I need to share.
Kindly share it.
I don't have share the screen. Okay, I see it. You have to give me.
I don't think you can. You can.
Yeah, that's it.
You're right. You were very quiet. That's unlike you. So, Anthea, while he's doing that, because I don't know how long it would take, if you please, give us your parting. I really don't want to keep you longer than.
Okay, thank you. Thank you very much. Congratulations on your award. You well deserved, my sister.
Thank you.
So, so I'd like to first of all thank everyone for listening and for inviting me to Medical Mondays. I truly am passionate about medicine, medical education, and improving health, not just of my patients, but myself and my family. And I have learned over the years that what you do, what you eat matters. And I would encourage everyone to be intentional about making sure that what you do, what you eat, what you say matters and adds value to yourself, your family, and your children. For me, lifestyle medicine is something that the field of lifestyle medicine is a field of medicine that our vision is that all providers of healthcare are educated on and practice as the foundation of medicine and not as a subspecialty. When I do attend lifestyle medicine conferences, we have all specialties there: cardiologists, dermatologists, surgeons, orthopedics, nephrology. So it is truly a multi-specialty field. So my parting words would be, let us endeavor to make sure that what we put in our mouth matters. What you do, when you move, make sure it matters. And when I say matter, let it matter to you, your family, and your patients. Let food be your medicine.
Amen to that.
Thank you so much, everyone. And have a good evening.
Thank you so much. Thank you. So Dr. Jagbe is ready.
Can you see my screen?
Wait 1 minute. Yeah, we see your screen.
Confirmed for the Heroes of Tomorrow's Africa Awards 2025. President Julius Maada Bio, a statesman of hope. Senator Natasha Akpoti-Uduaghan, a fearless voice for women. President Hakainde Hichilema, a leader of opportunity. Dr. Simbiat Adigije, a healer of hearts and humanity. President Basiro Diomaye Faye, a reformer reshaping Africa's story. Honorable Robert M. Chabinga, a defender of democracy. Mayor Ras Baraka, a bridge between Africa and the diaspora. Dr. Toyin Opasani, Dr. O, a servant of the forgotten. Ambassador Abubakar Jida, a global African statesman. Dame Sandra Mason, President of Barbados. Dr. Adeyini Ogunkoya, a life of medical brilliance and community building. Annie Keed, Funka Treasure, a trailblazing voice in media. Dr. Kavitha Das, a champion of equity and inclusion. Special guest of honor, Zoran Mamdani. Eric Adams, Mayor of New York. They are the dreamers and the doers, the fearless and the selfless. Join us in New York City, September 20th, 2025 at the New York Academy of Medicine from 6 p.m. to 10 p.m. Tickets available now on Eventbrite or at heroesoftomorrow.safrica.com/donate. Don't miss the night the world will remember.
Absolutely amazing. Congratulations, Dr. O.
Thank you. Thank you. You can fully dance.
Congratulations, sister.
Thank
That's
you.
Wonderful.
Congratulations, Dr. O from Nigeria.
You. Oh, thank you. Oh, wow.
Dr. O, congratulations, Dr. Park.
Thank you. Thank you.
Dr. Nwandu, fantastic. I enjoyed every bit of it.
Oh, thank you.